Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us. Hi, we're back, and today is a very exciting session. We have Dr. Arianne Shadi Kourosh, who is joining us, and she is the Director of Community Health Department of Dermatology in Massachusetts General Hospital, and she's an Associate Professor at the Harvard Medical School. Dr. Kourosh is the Chair of the AAD's Ad Hoc Task Force on Dermatologic Resources for the Intervention and Prevention of Human Trafficking, and she is doing such amazing work around this. Thank you, Dr. Kourosh, for joining us.
Thank you so much. Great to be here.
Yeah, you are doing such amazing work around, I'll let you get into it because you know it's so much better. But for me, I think as a dermatologist, this was such an important topic that I first heard from you and your group that I hadn't quite thought about. So I'm really excited to actually hear more. And then for our dermatology colleagues and just anyone actually listening, this is pertinent to pretty much everyone, these signs to look for. So I'd love for you to kind of just take it away and tell us as little or as much about how this got started and the kind of work you're doing around this now.
Sure. Thank you. So, as is often the case with us physicians, how something comes on your radar is when it impacts one or more of your patients. And so, how I first learned of the issue of trafficking is because I had founded our hospital's pro bono tattoo removal program for young people that were getting out of gangs. And so this was a way that our Department of Dermatology at Mass General and our wonderful resident physicians and even medical students that assisted with our clinic could be a part of a community service program and also learn the tools of laser tattoo removal through assisting these patients that were in need. And so this was an interdisciplinary program where primary care doctors, community organizations, social workers, multiple different stakeholders were helping young people that were trying to dissociate from gangs. And we saw that the way that dermatology could help is by offering pro bono tattoo removal services, which is, often a cost prohibitive service for people that are the most in need. So in the process of doing this work, removing the gang associated tattoos for these people that were trying to get out of gangs, they were incredibly helpful, incredibly grateful for the service that we provided because it helped them to be safe, because carrying around these symbols that were visible on the body could actually put someone at risk of being targeted either by their previous associates in the gang or by members of an opposing gang. And it also helped them to get jobs and to reintegrate into society. And so in the process of doing this, the similar stakeholders in the community that we were working with started to refer to our clinic this emerging population of young women who had predominantly young women, although also men can be affected as well, but who were forcibly branded with tattoos or coercively at least through their experience of human trafficking. And so this is how we first came to learn about this, which was through the stories of patients that would come to us for tattoo removal. And so we started to learn from them, about this problem, and that we got the sense that we were really dealing with the tip of an iceberg. Because, for example, I can say that for me personally, prior to these experiences, I had heard of human trafficking, but thought of it as largely, an international or, issue that was kind of distant and abstract that wasn't really affecting my patients in, our own neighborhood or in our own backyard. But through learning about these patients and their stories, I came to learn that this was happening to many people right here in this country, many people who are American citizens who have grown up here their entire lives. Of course, it's important for us to help everyone that is going through this, but I think that we started to understand that it was under the radar and it was happening far more prevalently than we realized. And so we started to look to the literature to try to learn everything that we could in order to be better informed and help our patients. And what we found is that there was actually almost no literature, at least in the academic or medical sphere, that was actually, a study or some sort of organized information about the skin signs of trafficking, or even really the comprehensive healthcare of people who are trafficked. And the one landmark paper that I found was actually not published by a doctor. It was published by a lawyer and a law professor at Georgetown, whose name was Professor Laura Lederer. And she was a really amazing individual who had helped to craft some of the first legislation that we had in this country around human trafficking, has been an advisor to the State Department, an advisor to the Department of Defense. And so she had published this paper in the Annals of Health Law in 2014, where she and her team had gone into shelters all around the country and interviewed human trafficking survivors about their medical problems. And they found, and they interviewed over 100 people, and they found that over at least 88% of them had reported passing through the healthcare system while they were being actively exploited and gone unrecognized. And so that was really eye-opening for me when I read that statistic, because I realized, wow, like, not only was I unaware of this until these patients came to me and told me their stories, but that most of us, according to the statistic in the healthcare system, might be encountering people that are trafficked and might not know how to recognize them, might not know how to help them. And then at the same time, in my search of the literature, I found another paper that was published by a group of psychiatrists in Texas, which is, a high density state for trafficking. And they were psychiatrists that were helping, these patients with the mental health aspects of their trauma. And they had noticed that many of these patients had certain skin signs or tattoos, and they talked about going to social media to try to understand what these meaning of these tattoos were, because there was, again, not organized literature, not sort of an organized screening tool or guidance or curriculum to help people understand this. So when I read their paper, I realized that our colleagues were actually calling upon us as dermatologists for our help, because we are the specialty of visual pattern recognition. We're good at picking up on visual patterns, organizing them, and describing them. And we're also the specialty that, we learned from our experiences that these patients might be seeking out, because we offer the service of tattoo removal. So I realized that dermatologists were uniquely positioned to make a difference on this issue, and started to reach out to, colleagues throughout the US who had also helped similar patients, and sort of data gathering and figuring out how we could learn from each other's experiences. And then the president and president-elect of the AAD at that time, who Mark Kaufman was president, Terry Cronin was president-elect, saw our paper. I'd spoken with them about the experiences we were having, and they really mobilized and were really struck by the dermatology piece of how we could uniquely help. And so they appointed the task force on human trafficking. And around this time, I had also found Professor Laura Lederer, this law professor. I found her email online, wrote to her and said, I'm a physician that's trying to help these patients. I'm looking for a mentor in my field, but I think you actually may be the best mentor and resource. And so we got on the phone, and she said, I'm so glad you found me, because you, the medical community, are actually the first responders on this issue. She explained that, these victims, survivors, for us patients, she said they often hide from law enforcement, but they often seek medical care. And so, she basically said that, the healthcare providers have this unique opportunity to recognize and to intervene if we only knew better and had the training to do that. And she furthermore said that she felt that the dermatology piece was one of the more novel approaches that she'd seen. And she, agreed to be an advisor to our task force, has been a mentor to me. And so she and I and the task force have worked together, and we've started to create educational tools and curricula and survey the dermatology community to figure out where our practice gaps are. And we're currently working with the AMA to post an official curriculum for them.
Oh my gosh, that's incredible. I'm just listening to the story and getting goosebumps, and so amazing what you've done, because I think in clinic many of us kind of see things, we might even catch a trend, but then we're so busy that it's easy just to pass by and not do anything about it. And just the fact that your group and you have started this whole initiative, and then just sparking this interest in the rest of us of, oh my goodness, yeah, that this is something, really notable, is just amazing. So just a huge thank you to you too for kind of taking this on. and starting this. And that statistic you mentioned with that paper where 88% had been through some sort of a, I'm guessing maybe ERs, urgent care, but it could be any setting, right? Like they've been through the medical system and
Yes,
this wasn't picked up. That's actually incredible. That's an incredible statistic.
yes, and you're absolutely right. And it does seem that the ERs and urgent cares are among the most common settings, and that is probably the setting in which we will seek to collaborate and work with as a priority in the using these curriculums that we're developing to train the medical workforce. And we're working directly with the American Medical Association, the AMA, and so we're hoping that that will help us to more broadly reach all physicians. But you're absolutely right. Emergency departments, urgent care, primary care, and then there are other specialties. For example, gynecologists,
Yeah.
and venereologists, for example. So gynecology and infectious disease could be also specialties that we will be working closely with because of the nature of the exploitation and abuse with sex trafficking. A lot of these patients, particularly, have multiple exposures to STDs and also multiple pregnancies and abortions. And so there's a lot of work to be done, and there are a lot of specialties that are going to be key stakeholders for collaboration.
Oh, that's amazing. And the other part was when you mentioned it is in our backyards. For some reason, we're trained as physicians to pick up on things like child abuse, elderly abuse. Even those we're not 100% on, but for the most part, it's on our radar for things to look for. But these types of things might be just as prevalent in our communities, and we're just completely, I think, not trained on them. It's actually incredible when you say it. It's kind of incredible how we've had zero training on these kind of topics. And you're of course on the East Coast, I'm on the West Coast, but even here, like in California around us, we hear it on the news all the time of these hotspots of areas where human trafficking is being picked up. And it's much more prevalent than we think. Like you mentioned, it's not this like, oh, it's just across the ocean kind of problem. It's in all of our backyards, and we're probably, and it makes me think as a physician, how many patients have I seen that I haven't picked up? Because it must have happened to all of us. So I guess what are the next steps? How can we, or what signs should we look for? So let's say on Monday I'm back in clinic. What are like the top trends or things we should be looking for?
That's a great question. So far, we have identified three major categories in terms of skin signs of trafficking, and I refer to them as the three I's. So the first I is for infection, and that can be infection slash infestations. So as I mentioned, due to the nature of the exploitation with sex trafficking, these patients are prone to STDs and sometimes multiple sexually transmitted infections. So that's something to be on the lookout for. Also, infestations because of the poor living conditions that people may be subjected to. And that's true of both sex trafficking and the other type of human trafficking, which is labor trafficking. And so in those situations, you would see that. The second I is for injury. And that has to do with the signs of abuse or scarring. And, we see physical signs of abuse in both sex trafficking and labor trafficking. And with some of the sex trafficking patients that I've taken care of, you also see signs of injury due to self-inflicted harm, such as scars from cutting, in terms of the trauma response. And so that's also something to be aware of in terms of physical signs that we may pick up on as dermatologists or, as the broader medical community. And then the third I is for imagery. And there are certain imagery in the tattoos, for example, that we started to pick up on. Now, when I was working more with people that were trying to get out of gangs, we worked with a police officer who was actually a member of a special task force in the police department that worked with the problem of gangs, and he came and gave us a PowerPoint presentation to me and to our residents and all of our volunteers about recognizing gang symbols in our region. And some of them are more thematic and more obvious, like, guns or weapons or violence.
Yeah.
And then also there are certain locations where you might notice them. Oftentimes gang tattoos are in highly visible locations, such as the neck or the head or the arm, because they're intended to be identified. That's kind of the reason that, rationale behind them. And so there are ones that are more thematic and general, and then there are ones that were more specific to regional gangs. Like, I had no idea that the Roman numeral 18 was actually a gang symbol for one of the gangs.
Oh
Now,
wow.
with trafficking, the similar theme holds, which is that there are certain things that we see thematically. um, I have seen weapons. For example, the first patient that I ever took care of had a gun tattooed to her neck, and that was a sign of the particular crime ring that was exploiting these women in New York. She told the story of being kidnapped from a party, and there was a group of women that were kidnapped, being drugged, and then when they woke up, they all had the same gun tattooed to their neck.
Oh
And
my gosh.
it was really important as a part of her recovery that we provided this service, and that I'm so glad to learn of our colleagues, dermatologists in different regions of the US. And I shout out to my colleague, Dr. Paul Friedman in Houston, who I've worked with on this issue and who has been volunteering in this capacity and also mobilizing volunteers. And there are several others in the American Society of Laser Medicine and Surgery and the ASDS, American Society for Dermatologic Surgery, who are now volunteering and providing these services. And so, something that I think that we've all experienced is that these patients are so grateful, not only because it helps them be safe and get jobs, but especially for the patients who have been trafficked, removing their tattoo is a part of their recovery. Because this patient, for example, that had the gun tattoo on her neck, she would cry whenever she had to look at it. I mean, this was part of her traumatic experience. And, she hugged us at the end and really told us that we had changed her life because she never had to look at it anymore. It's completely off of her. It's not, visible. And so anyway, so there are those thematic and general symbols like weapons and guns that we also see in the trafficking survivors. But then we also see other themes like signs of romantic sentiment or Valentine's, teddy bears, hearts. And then oftentimes there will be a name or initials associated with that, because sometimes the trafficker is someone who the patient believes to be, a love interest or a romantic partner. And so sometimes you'll see that person's name or initials with a heart or a teddy bear or something like that. Sometimes you'll see a crown, because it's this idea that that person, is the, owner or, ruler of the person who's being trafficked. We've also seen symbols of money or currency because of the nature of the transaction. And so in the trafficking survivors, we've seen these also in highly visible locations like the face or the neck, as I mentioned. But then sometimes the location can also be a private area like the breasts or the genital region. So in that situation, a location can also be an indicator. So here's what we've learned so far. But, I think that there is still a lot to be learned, and we are in the midst of a systematic data gathering initiative, anonymous data gathering initiative, to really learn more about these signs, and also whether they are regionally specific. Because as I mentioned,
Right.
with gang symbols, there are thematic symbols, but then there's regional symbols. And this may be true of the specific groups or criminal organizations that are engaged in trafficking. There could be more general signs, and there could be more specific ones.
No, that's so great to have like specific things for us to learn and educate ourselves. For me, I've always used tattoos as kind of almost like a conversation opener with patients when I see a tattoo, and these are just patients with normal tattoos for the most part. Oh, like that's a cool tattoo. Tell me more about it. Is that something that is generally a good idea? Should you, if you see a tattoo, whether you're thinking it's just a normal tattoo or this could be associated with something a little bit deeper, should you almost address it head on? What's the guidance around that, and how to just bring it up in an interaction with the patient?
That is a great question and a very important question. And I think that, it really has to do with the context of trauma informed care. And, with the American Academies of Dermatology's Task Force on Dermatologic Resources for the Intervention and Prevention of Human Trafficking, that's the official name of our task force on trafficking, we've actually posted an online toolkit where there are resources around not only the recognition, but also how to navigate a patient encounter, which I think your question is so important.
Yeah.
And we have a psychologist who we work with, Dr. Abigail Judge, who is a national expert on the trauma-informed care of trafficking survivors. And we also have a former nurse examiner for the DA's office, who is a trafficking survivor herself and a professor of nursing. Both of these women are experts, and we actually have a video of them talking about the principles of trauma-informed care and basically, kind of first working to build trust with your patient, and then assessing their level of comfort and with you as a medical provider, and then working toward those conversations. Now, I've heard colleagues who work with trafficking survivors themselves who have tattoos, like the medical provider has a tattoo, and they'll use their own tattoo as, for example, a conversation starter, and then ask about the patient's tattoos. And so, to your specific question about that, there are certain ways that people have used to build rapport, but I think that it really is a case by case basis. And I think that, I've learned a lot from working with these colleagues in the mental health community around, specifically who have experience working with trafficking survivors, about trauma-informed care. And I encourage all of our colleagues to, watch the video that they've created and on the AAD website, and also to just generally learn more about trauma-informed care, because I think it really is a case-by-case basis and a way that we can all grow in our skills of patient care and patient rapport.
Absolutely. That's a good point. I mean, if we can kind of wrap our minds around how to handle interaction like this, it probably just makes you so much better in all the patient encounters that you can have, because these are challenging ones to have. And that's a good segue into, you mentioned the toolkit, and any resources you have. Actually, we could link them even down in the show notes for this podcast. Any like call to action items you think for us that we should links that we should look at, videos, and you mentioned a few of those things. Like, what are the top things as dermatologists we should all utilize that the task force and your team has created?
I'm so glad you asked that, because we've been working very hard to create resources, and we really hope that people find them and that they're useful to our broader dermatology community and medical community. So the first, I would say, is the AAD's online toolkit for healthcare providers who may be caring for someone who has experienced trafficking. And you can find that by just doing a Google search of AAD trafficking toolkit. And there are a lot of helpful videos that we've created, online content that is drawn from, NGOs that work on this issue, our stakeholders, our collaborators who have expertise on this. And it's an ever evolving toolkit, and it's an ever evolving tool. So I would encourage people to, go back to it from time to time, because we not only have information and resources, but we're also working to create regionally specific resources. Like, for example, if you're practicing in a certain state, who are your local organizations or shelters or resources for patients that we think that this is actually part of preparedness of the medical provider to know what their local resources are, so that when we have that opportunity, we know how to refer patients to helpful contacts, and something that our colleagues who have a lot of expertise in the trafficking community talk about is something called a warm handoff, where I, as a provider, have, for example, gone out of my way to know who my mental health experts are in my healthcare system, my social workers, my women's shelters, so that I can tell my patient, if I'm in that encounter, I have someone who I work with, and her name or his name is this, and they really are a great person who I've worked for years, and I want to refer you to them and give you their number. And in the trafficking community, it's really been found that this is really much more effective than giving someone, for example, an 800 number of a national organization, right? So knowing our local resources is one form of preparedness. And this is something that we're working to create also in our resources. So number one, I would say check out the AAD's toolkit for providers that are caring for patients who are trafficked. The second thing would be that we have created an online registry of the skin signs of trafficking. And you can find that the link is redcap.link /trafficking. And that allows any healthcare provider, any member of a medical team, but also our stakeholders, for example, NGOs who work with trafficking survivors, or shelters, for example, who might care for someone or take care of someone and notice their skin signs, to be able to document this in an anonymous way. So it doesn't ask any identifying information. So it's totally de-identified. It just asks for, basic demographics and region, so that we can better understand if there are regionally specific signs. And so I would say, for anyone that may care for someone who experiences this, contributing to our larger repository of knowledge will help inform our curricula. And then, in terms of things that are coming down the pipeline, I would say we're really excited that we're soon going to be releasing a smartphone app called STEAR. And STEAR is spelled SSTEAR, and that stands for Skin Signs of Trafficking, Education, Advocacy, and Resources. And that is going to be a one-stop shop smartphone app that contains links for the AAD trafficking toolkit, our registry, as well as other helpful resources. And then I would say, if you are interested, if anyone who is listening is interested in helping, or maybe has expertise or experiences that they would like to share, please contact us, because we are always looking for volunteers, advisors, collaborators, stakeholders to work with our trafficking task force. And I think that that's really what is going to allow us to be successful, is to already we are working with all of our major dermatology organizations in the US. So the AAD Trafficking Task Force is working with representatives from the American Society for Dermatologic Surgery, the American Society for Laser Surgery and Medicine, the Women's Derm Society, and we're even working now with our international collaborators in the EADV, the European Academy of Dermatology and Venereology, and the ILDS, the International League of Dermatology Societies. And we've actually created an international alliance of dermatologists and venereologists that are working on this issue to gather data and better inform the medical community. So, there's no shortage of need, and there's no shortage of ways to help. And we will be thrilled for any and all listeners who have experience or would like to have experience helping us, to contact us.
Oh, that's fantastic. Thank you so much for all that. And of course, we can link all of that below too. And I think there's so much great info in there. I can't wait to dig in. I'm really excited to look at the app as well. And actually, the app makes me think of, so at the end of our podcast, we always ask, since it's the Future of Dermatology podcast, anything specific. And I know you mentioned a lot of upcoming things, but anything that you're specifically interested about in the future of dermatology?
Yeah, I think that what I'm really excited about is showing and highlighting the role of dermatologists and the role that we play in important key public health and human rights issues like human trafficking. And I think that, we've been doing work like this in our own unique ways in the dermatology community. I know so many amazing, inspiring dermatologists that are making impacts in their own way. And what I'm really excited about is to leverage technology, like using a smartphone app, for example, to serve as a clearinghouse for all of these resources and connecting people. And then also building these larger partnerships with other national and international medical organizations to amplify our impact. So I think that our partnerships and leveraging technology to connect people who are trying to make an impact is really just going to amplify the difference that we can make.
Yeah, absolutely. I agree with you. It's amazing now how we can just connect internationally so easily with all of our colleagues, and excited to also learn from our international colleagues too. There's probably so much data that they also have. So just the sharing of everything is fantastic. But thank you so much for all your work, first of all, that you're doing all of this. This is just amazing, and educating the rest of us. And thank you for sharing all the resources. And as things develop, just keep us posted as well, and we'll share with the group. But a huge thank you for all the work you're doing. It's going to make such a huge impact on many people. So it's just amazing. Thank you
Well,
again.
thank you. Well, thank you so much. And thank you for raising awareness about this issue and so many important issues through your podcast. I really appreciate that.
Good. Thank you again. Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.